Okay, this video is all about the medical uses of radiation. So, radiation can be used in medicine for two things: treatment to diagnosis. Let's have a little look at treatment first. So, we know from our work on the dangers of radiation that if cells have enough radiation incident on them, it can kill them. This can be very damaging for normal cells, but very useful for cancerous cells because we can use the radiation to kill those cancerous cells and therefore kill the tumour. And we can do this either internally or externally. Internally, a patient will ingest a radioactive isotope, will emit ionising radiation within the patient and therefore attack those cancerous cells. For internal treatment, we often use alpha or beta sources because they are highly ionising. However, if we are doing some external treatment, we might choose to use gamma rays. This is because alpha and beta are not very penetrating and are unlikely, if they are outside the patient's body, to make it to the tumour. They may be absorbed by the air or the patient's skin before they can make it to the cancerous cells. Ionising radiation is also used in the diagnosis of things such as cancer. One of the scanners that we use to detect cancer is called a PET scanner. And this, in a nutshell, is how it works. Take a substance like glucose and attach a radioactive isotope to that substance. This is called a tracer because it helps us to find where these cancer cells are. You then inject that radioactive tracer into the patient. It makes its way around the body to the organ that you want to look at. At that part of the body, radiation from the isotope is emitted and 2 gamma rays are sent from that part of the body out to the scanner which surrounds the patient. The scanner then uses those 2 gamma rays to determine where that radiation came from. These gamma rays are emitted in all different types of directions and it helps the scanner to build up a 3D image of what the tumour looks like. When using radiation for diagnosis or for treatment, it's important to think about the half-life of your substance. For diagnosis, these radioactive isotopes are sometimes made within the hospital. They need to have a long enough half-life to make it from where they've made to the patient and still have enough decays left to be detected. However, you don't want a half-life that is so long that the patient then remains radioactive for a long time after they've left the hospital. Typical half-life for one of these tracers would be roughly 6 hours for that reason. With these treatments and diagnosis, you can also in the process damage the healthy normal cells in a patient. So it's really important to weigh the risks and benefits of these kinds of treatments and diagnosis. Okay, I hope you found that helpful. Please do like and subscribe, download the notes. Thanks for watching.